You just fine.
All right, guys, come on over.
I think we're on the wrong side. I got lots of good shots.
I skipped this for the pelvis. We skipped these two structures. We're gonna go back to them. The ligaments of SI joint, exactly. So we're gonna go from PSIS. Remember ILA? Yep. We're gonna go PSIS. ILA is right here. If you just draw a line between the PSIS to ILA, you're just gonna strum back and forth on it, and you're gonna feel like stringy ligaments right there. Okay? Sacrotuberous is gonna go from ILA to the ischial tuberosity. So ischial tuberosity is like right here. I'm gonna go right here. Strum from the ILA to the ischial tuberosity, and you'll feel it. You feel that?
Yep.
Yep, exactly.
Are these on the spine checkout? Or are they on the they're from the pelvis?
They're from the pelvis. Yep, I'm just revisiting
Okay,
it.
got
But
it.
it's fair game, I think. I want you guys to feel this.
Which ligament is it?
ILA, sacrotuberous, ischial tuberosity to ILA. The long SI ligament is going to be from inferior lateral angle.
Oh, there it is.
PSIS to the ILA is the SI ligament, okay?
And then ILA to ischial tube,
Yep.
the sacrotuberous. Cool.
We're going to practice those guys maybe the last class.
Ischial tube to ILA.
Flip over, please.
Oh, sorry, yo. My bad, bro.
SI joint. Yeah. So we'll do like the first rib behind the clavicle for the neck. But for the most part, if you take the SC joint and you just count down, this is the first rib, second rib, third rib. You can just count down that way. Yep. But we're gonna focus in the manubrium. We know, right? So the very, very top of that. This is the sternum. We're gonna go all the way down. He has a little bit of an excavatum. That's like when it's like caves in a little bit. Look up the surgery to fix it, but his is
crazy.
yeah.
Yeah.
They like stick a rod in there and
Bend
flip
it.
it. Yeah, and they just break the whole thing. Yeah, it's crazy.
Hey, bro. Hey, bro.
Literally, he would eat cereal at lunchtime out of his chest hole.
So we're gonna do
Say it with your chest.
I don't know, it was cool. It was like Cheerios and stuff.
abdominals real quick. Okay. So rectus. Do we remember where rectus is from? Xiphoid too. Okay, remember we did like can you put your fingers right here? Gonna keep going down until you feel that right there. Okay. So lift your shoulder blades off the table a little bit.
To clear the
Like
A little
the
bit
whole
more.
way?
Yep, too much. A little bit more.
Muscle test, bro.
A little bit more. Go down. Keep your neck. Make sure your patient is never doing this with their neck. Okay, just keep your head back and a little bit. Too much. A little too much still. Maybe a little bit. Just lift it up a little bit.
It's like 100 and nothing.
So, a little bit. That's it. That's it. While that, so you can really get an outline of his rectus. Yep. Down.
This feels too weird.
You guys see that, right? I have my fingers on either side of the rectus. You can grab it like this. All right. We'll do the external oblique.
Yeah.
We're gonna put your hand behind your head. Gently, just bring. Where's the external oblique? So let's do this one. So we're gonna do too much. Sometimes you can see like a little bit of interdigitation into the serratus, right? Just go a little bit less. Relax. Go down. Go down all the way, and then go all the way.
All the way up?
Yep. Yeah. So So that is what you feel. What about for internal oblique? So I'm gonna do the same side, and then you're gonna bring your shoulder to the opposite side this way.
Yeah.
Yep. So the external oblique's still gonna turn on, but it's gonna be mostly internal oblique. Transversus abdominis is really, really deep. The way I do it, especially if I see like if patients are like turning this muscle on, I do like a big pinch on the side of the abdomen right here, and just bring your belly button down towards the table. Too much, too much. Yeah.
Do a pelvic
yeah,
tilt.
Yeah. Pelvic tilt is like a little questionable. So you should be.
Empty into your stomach.
I usually like do it with a spine neutral. I want them to be able to learn how to do it without moving the spine. So just a little bit. Just bring your yep, and relax.
What do you tell them?
You're gonna tell the patient to just bring their belly button in.
So breathe out.
What if they end up just sucking?
Yeah. Or they sometimes go, take a deep breath. Yeah, that also turns it on. Okay, let's try those.
Yeah.